GOURI has also been approved to be used at is hands. And as the aesthetic awareness bigger and bigger, they are more aware of areas like hands where. So if you realize that as we age, there's a volume loss and fat reduction over the hands, the skin becomes more and more lax, causing prominency of veins and tendons, as I already explained. And it could be of a lot of a bother to certain individuals, especially females, who wouldn't want their hands to look like. Just a reminder of how the hand anatomy works. So all the veins are quite visible on the hand, and that's, in a way, it's a good scenario because you'll be able to avoid the blood vessels easily. Basically, going to just go under the superficial lamina, and where there's not much of nerve endings and not much of blood vessels as well. So above the metacarpal plane, just going subdermal and suprafacial plane, we make a little entry point, and using the cannula, we go in between the fingers. Basically, we try to go into the web spaces. The vectors are all directed into the web spaces. If you can see here, so it's they're directed into this web space, this web space, this web space. And normally, these are the areas of depression anyways. And that's where there will be a filling effect straight away. So there's one thing that you will realize with GOURI usage is that there will be an instant volumizing effect as soon as you do the treatment. And most of the patients go out very happy, thinking that, it's happened straight away. But you have to remind them that the instant volumization is because the product has not spread yet. The product will spread eventually in next couple of days. The immediate result will wear off, but then there will be a later result again, which will go and become like the immediate result as well. So this is how I normally tell my client that, look, how you're looking now is going to be almost your final result. And most of the time, they're really, really happy with that. So pinch the skin and tent it up to open the dorsal superficial lamina space. Location is subdermis and suprafacial. Should be injected into the web spaces between the phalanges. So as you can see, again, I normally prefer to give an entry point lidocaine a little bit to raise the skin from the basal layers. And also it helps me avoid the structures when I'm making a little entry point. And once the entry point has been made, I go with my cannula and I inject into the web spaces in a linear retrograde fashion. As you can see, after 1 month, you can see the prominency of veins is less. The tendons are not visible, and the hand looks much more smoother and youthful.
Round about the wrist area, we should be having our entry point, but making sure that we are not going into any prominent blood vessels straight away. So I will avoid them. This seems to be my entry point for this. And from here, this is the web spaces. So pinching the skin up, as you can see, it's a thin skin. And then once you've pinched it, you go through and make a little entry point. So you can see it's gone in, and we're going towards the first vector, and we're going to be injecting in a way okay. As you can see, there's an immediate filling effect. And the immediate filling effect is because the GOURI itself volumizes it straight away. And then you tell the client that, look, this volumization will settle down, and then it will eventually fill it up uniformly everywhere, because this will spread